Hello friends, this is Dr. Pankaj Maheshwari from Fortis Hospital, Mulund. Friends, when we decide to manage UTI, it is not just necessary to treat the patient with antibiotics, it is very important to advise them lifestyle management. You would agree that it is a common myth among women that going to a dirty restroom increases the risk of infection. We have to explain to them that trying to hold urine, the risk of infection is much higher than going to a dirty restroom. Yes, if possible, you should avoid going to a dirty restroom. But if you land in a situation where you need to hold urine for long, it is better to empty yourself wherever possible other than trying to hold urine for long. Have adequate water so that the system remains flushed. When after motions, when you try to clean yourself, the cleaning should be from front to back and not back to front. If the cleaning happens from back to front, there is a risk of the infection from the anal area going to vaginal area and hence rising as urinary infection. Using a condom even in a couple who is married or with your regular sex partner is important. This not only will prevent the risk of pregnancy, this will also prevent the risk of infection. This serves as a barrier between two people and prevents the infection from going between the two people. Strict no to using feminine hygienic products like sprays. These sprays, these are chemicals which are not needed and they would increase the risk of infection. All that needs to be done is clean yourself well while you are having bath, change the undergarments twice, and no artificial sprays or hygienic products to be used in a vaginal area. Beyond this, you will need to treat the patient with antibiotics, especially if the symptoms are high or if the patient is running fever or if his total count or C-reactive proteins are elevated. Cystoscopy for diagnosis or treatment of UTI is a strict no. So a simple non-complicated infection, when the patient comes to you for the first time, the first line treatment would be nitrofurantoin, cotrimoxazole or fosfomycin. The advantage of fosfomycin is this has not been extensively used till date, so the sensitivity patterns may be better and a single dose gives a reasonably good response. About cotrimoxazole and nitrofurantoin, these are very old antibiotics. It is good to see that these antibiotics have resurfaced now. Bacteria have become sensitive to these antibiotics again. So let's be very choosy and choose our antibiotics well so that the sensitivity patterns remains good. Fluoroquinolones, cephalosporins and amoxiclav, these are antibiotics which to be used only if the first line therapy cannot be used, and these antibiotics should be used only once you confirm that there is a sensitivity on culture test. Fluoroquinolone resistance is on a rise. We have really misused this antibiotics and we are responsible for this increasing resistance. Also, there are increasing report of side effects, especially joint related side effects after fluoroquinolones, and hence be wary of using them loosely. Choose your patients well when you use these antibiotics. Adequate hydration, treating and avoiding constipation, using supplements like barley water or cranberry juice could help the patient. It would reduce her symptoms faster by alkalinizing the urine. Patient presenting with recurrent infection needs to be managed separately. Oral antibiotics in the form of fosfomycin can be given. They can be given long term. They can be given as a suppressive dose. And in women who get regular infections post sexual activity, a single dose antibiotic, a low dose single dose antibiotic can be given post sexual activity. So a single dose of antibiotic within 2 hours of sexual activity would reduce the sex related infection in this women. So for them, trimethoprim, sulfamethoxazole, nitrofurantoin, cephalexin, ciprofloxacin, all these have been used. They are used at a very low dose, around 1/3 or 1/4 of their therapeutic dose, and they are used as a single dose. If you want to give it long term or in suppressive protocol, even there they can be given. So fosfomycin can be given once in 10 days and other drugs can be given as a single dose once a day as a suppressive protocol. If the infection is severe, you may need to give a full course of antibiotics. The course may last from 3 to 7 days depending on the severity of infection. Among them, fosfomycin is the only drug which would have a reasonably good effect of around 90% with a single dose drug. Other drugs, depending on the type of drug, like nitrofurantoin will go on for around 7 days, but fluoroquinolones, beta-lactamase could give effect within 3 days. Thank you.